Good morning, everybody, and welcome to Sunday Mornings with Mike. My name is Peter Walsh. I'm the rector of St. Mark's Church in New Canaan, and I'm here with Mike Handler, the Emergency Management Director for the town of New Canaan. I wonder if we might all pause and just have a word of prayer. We're going to say it in the language of our church here, but wherever you are, I wonder if you might bow your head and say a prayer in your own way. Keep watch, dear Lord, with those who work or watch or weep this morning. Give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary. Bless the dying. Soothe the suffering. Pity the afflicted. Shield the joyous. And all for your love's sake. Amen. So, Mike, welcome back. Just want to say, as we start, crazy grateful to you for taking your Sunday morning to speak with all of us about the burning issue of our day. This is our third time together, which is amazing. That's 2 weeks, and yet it seems as though the amount of things that have happened might as well be 2.5 months. The rate and pace of news change is just extraordinary. I want to begin with hot news, if I might, here, undoubtedly on the mind of everybody out there, which is the things that unfolded on later Friday afternoon and Saturday and through Saturday night. The President of the United States saying he was thinking about quarantine for New York, New Jersey, and parts of Connecticut, and then the governor's reactions, and then you may not know anything more than we know, but what do you know about all of that?
So first, it's nice to be back. Thanks for having me.
Yep.
It's unfortunate, but politics is definitely playing a role in some of this response, and there's no place for it. So I think the evidence is pretty clear that the nation, state, has been woefully prepared for this, and we're caught off guard. Even though we had a couple weeks advance notice watching our friends overseas, we just didn't act fast enough. So I think the reaction locally from the president's tweet yesterday about potentially quarantining parts of Connecticut, New York, and parts of New Jersey were caught, as kind of a shock to some people.
Yeah.
But it really shouldn't have been a shock. It's really what we've been trying to encourage in our town for a couple of weeks since we started talking. The rate of growth of infections and serious illness as a result of the infection is dramatic, and we haven't even seen it yet. So I do think it's a very real problem that we have people coming from Manhattan up to Connecticut, infected and seeking care. And I understand why they're doing it. I don't fault them for doing it. If my wife were due to have a baby in New York City, I'd probably be looking to move her to another hospital somewhere else. But it's real. I've talked to the emergency rooms and the critical care units in the local hospitals daily, and they're seeing an incredible influx of people walking into the emergency room that are really sick. They just drove out of Manhattan because they want to find a hospital bed where they can actually get, service. And right now, it's pretty obvious that if you're in Manhattan, there's a real crunch for beds and care, and people are worried about it. All the efforts that the president's making available aren't going to be here for a couple of weeks.
Yeah.
And the need is right now. So I think, unfortunately, we were ill-prepared. I think the public's reaction to seek beds and care where it's available is natural. We're going to see it. I think you're seeing, in the real estate market, you're seeing homes renting for astronomical prices right now because people want to get out of Manhattan at any price possible. And that's unfortunate, but they need to be responsible about it. So our message is, and should continue to be, if you're coming from another community, great, but you need to take care of yourself and us as well. You need to stay in quarantine for 14 days, develop symptoms. We're here to serve you, but you cannot just be freely walking around our community. And it's tough. I mean, there's different extremes. Rhode Island's taking it to an entire extreme, where they're going door to door. I do not suggest that's a possible New Canaan policy, for the obvious reason that we don't want to put our first responders in more harm's way.
Yeah.
So I think it's unfortunate, but it's just trying to catch up to a failed effort to react quickly enough to do what we have to do. And it's serious. People are scared by it. You have to ask yourself, how is quarantine any different than what we're doing right now? So the critical food delivery, food pickup, that has to continue. Mm-hmm. Pharmacies have to be able to get pharmaceuticals to the homes where they need them. So that stuff's not going to change. So non-essential work should have already stopped. A strict quarantine in New Canaan wouldn't change a whole lot.
So 2 questions come out of that. One is, just want to talk about the New York issue for a moment. I know that I've been on these communal phone calls that you, when you have a moment, join also. the real estate market, the realtors in town are abuzz over this. We have noted to me recently was one of our local grocery stores, Walter Stewart's, had many New York plates in the parking lot the other day, and suddenly a New York license plate became a thing, a difficult thing, and I happen to know many people who live in New York State. My house is about 3/4 of a mile from New York State. These people from Scott's Corners and Pound Ridge come in always to do their shopping, and now suddenly they're feeling persona non grata as they cross over, and we as a people finding ourselves scared of each other, I guess.
So I think we have to be, A, aware that it's going to happen and prepare that it's going to happen. So we know that our local supply chain of food is limited. I know that scares people. I think we've done a remarkable job. The 2 grocery stores in town have done a remarkable job. Our contribution to all that is providing equipment and training and stuff for them to stay safe as long as they can, and also to be prepared to provide backup in case some of their staff gets sick, which is inevitably going to happen. We hope it doesn't, but we know it's going to. So we are prepared to keep the supply chain going at whatever cost possible. That being said, when you bring in a new population into a town like New Canaan that puts a demand on the supply chain, it only gets harder. So we got to be prepared for it. I don't think we have the ability to close the borders. That is the governor's responsibility. You got to think about the irony of talking about quarantine but still having Metro North running, right? So you can close borders. There's steps you take long before you get to that point. I think from an emergency management standpoint, we are prepared. We see it's happening. We've done a lot of things, and this is part of the challenge with this whole communication piece of this, and that's why I appreciate being here. It's very tough to explain to somebody in a 30-second or 1-minute call each night, which I question the value of that call in the first place, to be able to share with the community all that's going on behind the scenes.
Yes.
Because there's a lot of stuff that we're doing that people just are not aware.
That's for sure.
So if I can for a second, I just want to walk you through
take more than a second.
What we're working on. The job of public safety in New Canaan that falls on a bunch of us as first responders is to protect the lives of 20,000 citizens in New Canaan. And we do a lot to prepare, to train, to equip, to make sure we have all the tools and training that we need to fulfill that mission. But it doesn't end with the 20,000 people that are in New Canaan. Think about this. As good a job as New Canaan EMS and the police and fire departments can do responding to medical calls, as soon as that ambulance crosses the border into Norwalk or Stanford, they're going to a hospital that needs to care for our citizens. So if we don't do enough to prepare and support them, then there's really no value in our care here because they're going to a hospital that's not prepared to take care of them. So right from the very beginning, we're going on 3 or 4 weeks now, I have been working along with my partners in New Canaan with the private sector and with the not-for-profit sector and the hospitals to better prepare them and equip them for that which they're scrambling to do nationwide right now.
Yeah.
So for weeks now, we've been talking about increasing capacity at hospitals and demonstrating ideas and how they can do it, providing services, providing goods, whatever they need to do it. We've worked on ventilators, masks, gowns, and we've got some remarkable partners in town. So we've been working with the Connecticut Relief Fund, which was started by Grace Foundation.
Yeah, incredible.
And fully funded a procurement process that pretty much blows the state and federal government away.
Incredible.
You have to ask yourself why that's possible. It was my hope that that would never be necessary, and truthfully, it should never have happened, because the federal government should have taken over all procurement, because what they've done in hindsight is they've actually created a lot of competition for the same scarce goods. So we have been very creative, working around the clock, again, with the private sector and the public sector, working to procure equipment that's vitally needed.
Yeah.
I want to talk about personal protective equipment for New Canaan. We reacted quickly. So early on, no one should be concerned that our firefighters, police officers, and EMTs are not carefully and prepared and equipped with the equipment that they need to serve the public. We have everything we need for the foreseeable future, and we're continuing to build on that, but we're not concerned about the safety of our people. That's our first priority. If our EMTs, police officers, and firefighters go down, we're in a world of hurt. So yes, some of that's going to be necessary also. It's not all science. Some of it's going to have to be some prayers for them as well, but we are prepared locally. That being said, what good is New Canaan being prepared if the surrounding towns around us are not prepared? So we have worked, again, collectively with public and private partnerships to supply equipment to all 14 towns from Region 1 and the states in Fairfield County, and the hospitals in Fairfield County.
Wow.
And that's already begun and will continue to go through the next week or so. And at some point, it's our hope that that supply that we're providing is met with the supply the federal government is going to give to the state. But right now, I can tell you the state is sitting back waiting for the federal government to save the day, and the federal government is just not coming to save the day. And the need is right now. If we provide it in 3 weeks, that's terrific. But all of our healthcare workers in our hospitals and our EMTs are all going to be sick before that point. So it's not really, acceptable for me to sit back and wait for that to happen.
Yeah.
So a lot's happening, and that's going on around the clock. We're using town and emergency services to deliver stuff throughout the communities to make sure everyone's protected. Nursing homes. So one of the first things we did in New Canaan is provide personal protective equipment to staff at nursing homes and Silver Hill and places that have high occupancy. Why? Because those are the places that can put the biggest drain on the system if they start having high incidence of infections. So we try to protect them as much as we can, because if we don't, they then turn up to us to support them, which then goes to the hospital, which just creates a staggered effect up the chain, and that's where you end up having a backlog. So we've done what we can locally. We're not done yet. We continue to do it, to work with our partners to make sure that we keep everybody safe. But we are seeing, right now, we're in the middle of it. We're seeing the crunch. We're seeing the numbers double every 2.5 days.
Right.
So by no means are we out of the woods yet. I know people are taking some false comfort in the testing results we're getting. They're seeing the numbers not go up dramatically, but that's only because we do not have the results back yet. So the call volume to EMS is enormously increasing versus what we've seen in normal days. Yep. So that's only going to continue to happen. So I think it's important for everybody to not put too much reliance on data, because I'm telling you, the data is not accurate. We have not gotten a single test result back from any of the 3 test sites that we did in town. And that's a colossal failure of our country in terms of the inability to test. It's almost like a third world country in terms of trying to test. It's unbelievable to me that 8, 9, 10 days later, we still don't have test results back. But it's the reality.
Well, I might just add there are other countries that might get categorized as third world countries, but are very used to disease and have a whole national network built for it, where they know how to vaccinate their whole populations. Right. This is something they do. All the citizens take it seriously. And, we also have questions of the American way, recalcitrant citizens who think that the coronavirus is something, and they don't want to play by the rules. And tell me about how you all think about people who don't want to play by the CDC rules.
So I'm happy to say that the vast majority of New Canaan is taking this seriously. So I think the instances, and believe me, I hear about every one of them. I get a photo of every group doing anything in town. The vast majority of people are heeding our warnings and are self-isolating and failing to gather, which is important. Sure, there's going to be 1 or 2 house parties that we've got to send the police to deal with. That's very unfortunate, but it's far and few between. So, again, this has come up. A lot of people have asked the question about parks and fields.
Yes.
It's hard. We want to protect everybody, and that's our number one mission. But there is some benefit, I suppose, to people being able to walk in the trails and safe distance apart from each other and actually get outside and get some fresh air. My messages, I hope, have been clear that if we see non-compliance in our fields and our parks, we will not hesitate to close the fields and the parks. I think that might imply to some people that we're tolerant of certain groups being out there playing group sports. We're not. So to the extent that's happening, we're doing our best to safely stop it. But the only alternative we have right now is to shut everything down, which is a possibility, but we're taking it one day at a time. Days like today where it's raining, it's less of an issue. So we talked about this at length last week. We opted not to act on Friday because of the weather. If it were nice out and we saw people acting in ways that were not conducive to a healthy environment, we would have stopped it.
One of my sons was on the AstroTurf field, and he said, "Oh man, Pa, I saw this guy walking around." I think it was Kevin Moynihan, our first selectman, or maybe it was Steve Banco, who oversees all that, trying to police groups. And to my kids, they moved farther apart because they saw the authorities moving about. But anyway. These are these ambiguous questions. We need to move our bodies to stay healthy, and yet, what to do with public spaces. Very, very interesting. So you were just a moment ago talking about the behind-the-scenes work that is being done by so many people here, helping the greater community. I wonder if you might just say a word. One of my great concerns is that somebody will have an auto accident, they're going to slice their finger with the cucumber slicer, or they're going to have a heart attack. So non-COVID-19 related issues where we would normally go to the hospital and suddenly the hospital is a completely different zone. I wonder if you might have a word about that.
So I can tell you that we are seeing the same instances of injury and non-COVID related medical calls. We had people fall off horses, car accidents, it's all still going to happen. What is changing and what will continue to change and evolve in the next couple of days and weeks is that every case we come across, I don't care if you were shot by an arrow from a bow hunter, it's going to be treated by our first responders as if you're COVID-19 positive.
Yeah.
Because it's like this old myth that if you test positive for flu A, it automatically rules out COVID-19, which it doesn't. So I think we're going to see the rate of increase of instances of infection in our community so great that everyone's going to be presumed to be positive, which is smart from a public health standpoint in terms of how we treat people, but it's also very cumbersome in terms of how much personal protective equipment we need now to treat every single patient. So I think people remember early on, if you called 911, there was some real value in telling somebody that you recently traveled or were in touch with somebody that was tested positive. None of that matters today.
Yeah.
So I think that's the negative. But you're right. I think the byproduct of the hospitals being so overwhelmed with COVID-19 cases is that people that need to go to the hospital for normal care are going to opt not to do that. So we've got to find a better way of handling that. So I think in New York City, what they're doing, they're bringing in a naval ship. The idea here is to treat non-COVID-19 related cases. How they're going to determine that is beyond me because there's no testing capability. So until we have a rapid test that you can say yes or no, you're exposed, you're going to have commingling of COVID-19 and non-COVID-19 cases on that ship very quickly. So I do worry about, we see it on snowstorms. We see people that shovel snow and, a day after the snowstorm, they're fine. Then 2 days later, they're having a heart attack from 3 days earlier. They just didn't want to go to the hospital, so it was snowing out. Or holidays are a better example. No one wants to go on Christmas Eve to the hospital. But, on the first, 2nd of January, they're all going to the hospital because they realize that they're having chest pain. So people need to watch out for themselves, take care of themselves. I would prefer to see less risky behavior. In my own personal home, my wife and I talk about it all the time, that we don't want to see our kids jumping off things because if you break that arm, what do you do today?
Right.
It's a challenge.
Right.
So reduce the risk as much as you can by still trying to keep your sanity would be very much appreciated.
Yeah, no time to become a skateboard pro.
Exactly.
I want to have you, I want to revisit something from last week. You are so immersed in this. I mean, you must be dreaming about this. I'm dreaming about it, or I'm having weird dreams at night. You don't need to comment on your dreams. But
you have to sleep to have a dream.
You have to, okay, nice. Actually, I hope you all heard that. You have to sleep to have a dream. Last week, you made mention, as they say, you said, as part of our conversation, well, everyone's going to get it. And an alarming statement to so many. I wonder if you might just clarify what you mean by, well, everyone's going to get it. Just want to revisit that.
So from the onset, if I didn't make it very clear, let's clear it up today.
Okay.
No steps that we're taking today in terms of social isolation, lack of social gathering, and social distancing. All those terms that we all are very familiar with today and previously never heard of before.
Yeah.
None of that was designed to keep everybody from getting infected with COVID-19. It's progressively going to go through like everyone's exposed to flu every single day of their lives. It's simply meant to do one thing, and we had a chart on from the very beginning, and that's all it was meant to do. It was meant to keep everybody from getting sick at exactly the same time.
Yeah.
Because that is, again, the vast majority of people that get COVID-19 are going to be okay. Now, I can't say with absolute certainty that I was able to say 2 weeks ago that it's only going to affect those that are over 65 or those that have pre-existing medical conditions, because we now have evidence, unfortunately, that infants and young people are having bad outcomes. Not to an alarming rate, but it's not as if they're immune from having a long-term negative outcome.
Yeah.
So, again, I want to say it again. We're not trying to keep you and I from getting exposed. We're trying to keep you and I from getting exposed right now. Because at some point, we will be able to ramp up the available beds and available critical care beds in our hospitals. and we'll be able to ramp up our staffing to where we can treat, instead of 24 ICU patients, we can treat 100 ICU patients in a hospital. And that's the critical decision. The hardest thing, and anybody that's worked in public safety probably knows this, the hardest thing for any first responder to go through is to show up on a scene of whatever the accident may be, and to consciously recognize that your ability to provide care is outnumbered by the number of people that need your care. Because it forces you to make decisions, and in EMS it's called triage. We do it all the time. Fortunately in New Canaan it doesn't come up all that often. But what I suspect is happening, and we know it's happening right now, and we saw it in Italy, we're certainly seeing it in Spain, and we're going to see it here as well. You see it in Elmhurst in New York. You're seeing doctors, nurses, medics that are trained, that know how to help and treat people, not be able to treat people. And that's what this entire effort is about. It's preventing those people from being in that position. People are going to die from this. We're trying to stop people from dying needlessly, and that's because they don't have the resources available to treat them. And it's really a race. How long does this last? It's simply going to last until we have a viable antiviral that works, and they're working towards that. There are a lot of experimental drugs being used right now or reused right now, or a vaccine. And once we end up with a vaccine, so 3 things have to happen, right? So antivirals to treat those who are really sick, a vaccine that makes it so you and I can go out in the community and have less of a response because we build up some immunity, but also we need testing. So unless you can actually test to see what the community's antibodies are, putting us back in the general population too quickly will put this curve right back into play again. So, it really comes down, and again, I'm not an epidemiologist, we should say that, if there's a way to put a disclaimer in the bottom, we should say that.
Mike Handler, not an epidemiologist.
It's important to realize that this is not about keeping the community from getting exposed. We're all going to be exposed at some point. The question is, will we all need an ICU bed at the same time? And that's the issue.
Yeah. So these vaccines and testing and all of this stuff, which is kind of like the cavalry coming, but my understanding is the cavalry is not coming anytime too soon, so we're going to need to fight this battle. And so in order to fight the battle with a lot of questions about the kinetics of the disease, we take conservative approaches to the best we can in order to hunker down. Now, I read, and I wonder if you might comment on, something that said, if we all do the right thing, we as a community do the right thing, the spike in cases, that graph that you showed us that first week, and well known to anybody who's paying attention, that spike could be in August for Fairfield County, for this portion of our Connecticut. I don't know if you saw that. It was in the the digital paper that came across. So, you have a comment about that?
Yes,
the timeline?
I can tell you with absolute certainty, if we don't do our part to socially isolate, that curve's coming in the next 2 to 3 weeks. And we know it, and we don't have the capacity to handle that. So anything you can do to shift this off into the future date is only going to work to our advantage. So we know right now, and you're seeing it in New York, right? You're seeing it at Elmhurst. You're seeing doctors having to make decisions as to who to intubate and who to get a ventilator, and that is not a good position to be in.
No.
So again, if it comes in August, we've got to prepare for it to be in August. This is not a one wave and we're done. This will come back again in October. We're going to see this for a better part of a year. The question becomes, every day that goes by, are we that much closer to getting a vaccine, antivirals, or actual testing that actually is accurate? And those are the 3 things that are critical. And by the way, as a community, there's things that we think we're able to do a lot for our community, and we are. There's things that we are truly self-sufficient on. We're proving to ourselves right now, we can protect our first responders, protect our community, feed our community, house our first responders if necessary, which we're working towards, and we can also work on providing personal protective equipment and training to everybody that needs it in our surrounding areas and our hospitals. We can do all that. We don't need the state, proving we don't need the state, we don't need the federal government to do that. What we can't do is build a mobile field hospital. What we can't do is bring in 200 intensivists that can work in an ICU or respiratory therapists. We can't bring in vaccines, antivirals, or testing. That's all left to somebody else, and what gives me comfort is the private sector is working tirelessly to do this. Yeah. So we're going to get there, it's just we're not there now. So believe me, people have asked me, can we build a mobile field hospital in the parking lot? It's great that we're thinking that way, We took a different approach to provide both Norwalk and Stanford as much resources as they could use to ramp up their capacity as fast as possible. Because the federal government, I think the state just got around to coming to see potential sites for expansion for hospital beds end of last week. We started 3 weeks ago. So, it takes time to do this stuff.
Right.
What we're finding is there's no quick switch to flip. So I don't think anyone here with the science labs in the high school are going to find the vaccine or the antivirals. So I think we've got to just do what we can to reduce the rate of incidence every day and let the professionals that are working on the drug treatments and the antivirals and the testing kind of raise up the capacity as much as they can.
Okay, so thank you for that. Let's talk a little bit about that, just for those of you who are tuning us in and may not know where Elmhurst is. Elmhurst is in northern Westchester County.
No, it's in, I want to say it's in Brooklyn or Queens.
Oh, that hospital. Okay, yeah. I thought you were talking about another. Oh, you're talking about that. Okay, there's
Yes.
two of these. Right, okay, great. Okay, so I'm glad to clarify that. The next thing is, so my understanding is there are healthcare workers who do come home, take all their clothes off in their garage, put them in a bin, walk in, throw their clothes, boil their clothes basically in the hottest cycle they can, don't walk by any people in their family, go in and take a hot shower, soap down completely, and before they walk out and say, hello, everybody. So these people are obviously working in places where there's potential greater exposure. But what about for the common man and the common woman and the common kid who wants to go, who is out of milk and wants to go to the grocery store? Tell me about the comings and goings. You have 5 kids. You cannot fill your refrigerator with enough food for 5 kids, I know, because I'm trying. Tell me about that.
So the average citizen that goes out and does what they need to do needs to be mindful of how they're doing it. So washing your hands is as effective if you do it correctly as using hand sanitizer. You need to make sure that when you're touching things, you're not touching your face. So this virus has been proven to live on hard surfaces and soft surfaces for extended periods of time. I think we all thought it was 2 weeks or week, 2 weeks. First it was 3 days, then it was 2 weeks, and I think they've discovered on cruise ships that it's lasting more than 17 days on hard surfaces. So I think it's very important that we just are mindful of what we touch with our hands. So go to the grocery store. There should be hand sanitizer. Wash your hands before you go in. When you get in, touch what you have to touch to get in your cart, pay, don't touch your face, come out, wash your hands again. When you go home, it's not a bad idea to take your shoes off and leave them in the garage. It's not a bad idea to wash your hands before you get in your house. So in my house, at all of our doors, we've got hand sanitizer outside the doors. So before you actually open the doors, you're actually washing your hands, going in the house. And the first thing I do after I put hand sanitizer on my hands and open the door is go wash my hands. And we should all be doing that. And that will help everybody. Let's go back to first responders for a second, because what you just suggested, it's called donning and doffing your personal protective equipment. We have provided great equipment to everybody to make sure they're as safe as they possibly can be. But eventually they've got to take that off, right, and they've got to go home to their families. So what we're seeing, and the private sector is filling the need also, but what we're doing in town, and we've got plans and the capability to house anybody that works in our first responder community that does not want to go back to their home for risk of infecting somebody that's living in their home. So if you have immunocompromised family members or older parents or grandparents living in the house with you, you can come off your shift at New Canaan EMS, and we can find a place to put you that we provided a home for you, so that you don't have to go home between your shifts.
Right.
We set that up 2 weeks ago. We haven't had to use it yet. We offered it to people that were quarantined on that first call we had in town, but they managed without it. And we're not going to mandate it, but at some point it's going to be mandated. I see it coming in the hospitals. Hospitals are taking entire hotels adjacent to their hospitals, and all the nursing staff are going and staying there. There's really 2 needs, right? There's one, if you develop symptoms while you're at work, we don't want to put you back at home where your family is at risk, and we have an obligation to take care of you. So we're going to find a place to put you where we can actually keep an eye on you. And likewise, if you're healthy, but you've been exposed, and again, our professionals are trained well to understand how to take off their protective equipment so they don't infect themselves. They understand how to look out for each other, make sure they're doing it properly, but the risk does exist. So as a community, we've provided whatever is necessary to keep them safe. If we lose our first responders, our nurses and our doctors, the game changes dramatically.
Yeah, yeah. Thank you for that. I'm going to come to Jill in one moment, but we have more parishioners, for instance, who have tested positive for COVID-19. They are young people to older people, and are all at home, quarantined, and managing their sickness. One of the questions that keeps coming up is, and I know you already said, I'm Mike Handler, not an epidemiologist, but I wonder if you have any comment, because this is a question that I keep getting over and over. Once you have had it, does that mean you will not get it again? Do you have any more insight on that?
Well, the same insight that you would have if you look at what's publicly available. There are instances of people having gotten sick with COVID-19 for a second time now.
Okay, so there it is.
That tells me that it is possible. I don't know the prevalence of how often that can happen, but to think that because you've been exposed to it once and had a mild case does not mean you will not get it again.
Okay. I just want to say that is a piece of news that is not necessarily completely known. There's been so many unknowns here. Jill Sekoulis, who is the Director of Operations here at St. Mark's, has been collecting some of your questions. Jill, let's go to the phone, as they say in some other TV show I never watched.
A lot of questions this morning. But I think that this one, Mike, the first time we spoke with you, you said, can you help me addressing the mental health concerns that come out of something like this? I have an email from someone who says, I figure that as a senior citizen, so going back to we're all going to get it, I figure that as a senior citizen, when I get it, I will die from it. We're doomed regardless of what we do.
So I hope that is not a belief that's widely shared among the community. So if we are able to slow this down, there will be treatments available, ventilators available, doctors and nurses available to treat the vast majority of the public. It's only if we all show up at the ICU at the same time where we have a problem. So this is not necessarily a death sentence. I'm sorry that this person feels that way, but I'm telling you, as long as we can keep you safe for a couple more weeks and give the professionals a chance to actually develop treatments, I think we're all going to be a lot better off. Can I ask a question also of the community that you're with now online? I would love to get some feedback, if we can, about the messages that are going out daily. I've thought for a while now about only putting out information when there's a dramatic change or a relevant change to share with everybody. But there's been a lot of pushback that people want to hear at least every day that we're doing something so they kind of know what's coming and expecting the next day at 7 o'clock. So I don't need you to read it all out, but just, if people can send in yay or nay on the 7 o'clock calls, that might give us some guidance. Go ahead, next question.
Okay, you heard it, people. Flood my email, I guess. Okay, a lot of questions that you've already addressed about how the hospitals locally and our local healthcare workers are working to expand capacity and looking at the questions of field hospitals and things like that. A couple people are asking, again, Mike, not the epidemiologist, what's your best guess of when the virus will peak in our area? And also any thoughts about what it will look like post-peak? What does reentry look like?
So two very different questions and both very difficult to answer. I don't know when the peak comes. I know the peak would be here in the next week to 2 weeks if we did nothing in town. So I'm hopeful that the peak, the rates are doubling, my sense are doubling every 2.5 days right now in the Northeast. That's alarming. So I think continue doing what we're doing now until such time as we're told that we have effective treatments, effective vaccines, and effective testing. I personally don't see how we unwind the social isolation until we have at least 2 of those 3 things available to us. The second question was what? How long does this last? Or what does it look like when it ends? Is that...
Yeah, what does it look like when we're able to begin to gather again? Is it a gradual thing?
So I've heard different, and again, I don't have the answer, but I've heard different thoughts about this. One is that we would release portions of the country to go back to work and not release other portions of the country. I've also heard that we would release segments of the population within a community to go back to their normal lives and not others. What that means to me, and I don't share this belief, is that we can actually send younger people back to work and function, but isolate our seniors and those that are vulnerable from having any interaction with them. That to me seems like a pretty draconian way to go about this. But I'm also mindful that you can't shut the economy down forever. So I also, I have a unique position, right? In my position for New Canaan, my job is not necessarily to balance the global economy. That's not my concern. My concern is to protect the lives and citizens of New Canaan. It's not to say I'm not aware of the impact this is having on many people in New Canaan, and not going to work and not being able to provide for a family the way you normally are used to is detrimental also. You got to balance the two. So I think we got to give it a couple more weeks to figure out kind of what this looks like in the back end, and it really comes down to, again, testing capabilities as well as treatment. Because until we have that, I can't kind of give you an idea of when this is going to end.
So if I might just leap in here, again, there's the unanswerable questions about what is the timeline, what does it look like. Many of the questions that we also get come from parents of children. So the stress of now parents homeschooling their children, essentially. I mean, the assignments come in from the dispersed HQ over the line, and will our kids return to school? And I know it's a complicated question, because there's public school kids, there's private school kids, there's college kids, there's people who want to graduate, there's all this sort of thing. Any sort of sense about timelines and schooling and kids?
Well, we have to start with the remarkable job that Dr. Lutzy's done with our schools and our teachers are doing right now. Again, with a fair number of kids in the schools, I can tell you that learning is still happening. It might not be the same learning that we're used to in our everyday lives prior to COVID-19, and the same interactions aren't there, but the learning is continuing, which I think is remarkable given that they kind of got this going pretty quickly.
Yeah.
I don't see us returning to a normal environment in any aspect of our lives until such time as we've got adequate testing, adequate antivirals, and adequate vaccines. So I think it's going to be some time. I don't think anybody's going to rush people back to school if we don't have at least two of those three things.
So just why don't I not just keep lobbing unanswerable questions to you here? So one is school. So then you get into, oh my gosh, my kids always go on summer vacation. They go to this summer camp, and okay, all we need to do is slug it out over the summer, but when the fall comes, we're back to normal. So I understand that ain't true. And so, as you said, our first gathering, this is a marathon and not a sprint, but maybe this is a triathlon. I think marathon's too small. Ironman, right. Iron woman, iron human. So a word about any of that stuff?
Yeah, so again, I'm not an epidemiologist, but conventional wisdom has demonstrated, and we don't know for sure if this is a typical virus that dissipates with heat or if it comes back in the fall. But I personally am preparing that this is going to have another wave for all of us sometime in the fall. But that's scary. But it's less scary if we actually have antivirals, a vaccine, or testing capabilities.
Yeah.
And if we have adequate supplies of PPE for our responders and adequate capacity in our hospitals. So once we get to that point, this crunch is not going to be as critical. I would not be losing as much sleep as I'm losing right now if I weren't worried about the run on the hospitals.
Yeah.
So if we can address that issue, then I think we can all rest a little bit easier.
Yeah, let's get the hospital sorted out before summer camp. Jill?
So a lot of questions continuing about testing, and everybody understands that right now they're being filtered by people who are symptomatic, right? So in general, people who are asymptomatic aren't getting tested, but it seems like we're hearing that people asymptomatic are still vectors. What can you say about the question of trying to get a test if you're asymptomatic but have had close contact to a positive case, et cetera?
So let's back up a second. As a community, we've done everything we possibly can do to provide testing, whether it be at the local hospitals or in an in-town testing site. We have, again, within our control, certain variables that we can actually achieve success with. We can actually set up a testing site. We can encourage people to come out, properly screen them, properly swab them, put the swab in a medium, seal it, and ship it on ice to a lab. We're then solely dependent on the lab. And Quest and LabCorp, we were very thankful that they were able to start doing the testing, are not able to handle the load, period.
Yeah.
And there's not much we can do locally about that. So because we're doing PCR testing, it requires a viral load. That viral load needs to be high enough to where it normally presents itself with symptoms in an individual. So if you're asymptomatic, the high probability that you test positive, it's gone. It's almost zero. So that's why that testing isn't really appropriate. Plus, there's limited testing available. So in New Canaan, I'm not sure people are aware of this. In New Canaan, to conduct testing at our 3 sites, I had to go to our local pediatricians and take their swabs. Now, they offered them up, which was very nice, but we had to deplete our local supply of test swabs from our local pediatricians, who were, again, great partners, willing to support whatever we needed, and whatever we needed, they pretty much gave us. But that's, if we use it for everybody in the community to get tested, and if it's a PCR test that tests for viral load, we'll get false negatives because people won't have enough of a viral load to show positive, and we'll have no capacity to test again. So that's very different than what is happening in other parts of the country. People do have the capacity to test for antibodies in an individual, and that's the test that we need. We need a rapid test that shows if you've been exposed to the virus, not if you have symptoms or not. So we're waiting for it. The hospitals are waiting for it, and we're waiting for it as well. Once it gets here, we can test the entire community. We can go through 100% of the community and test everybody, and we'll know where we stand. And then scientifically, someone, not me, can decide if it makes sense to free up the community to go back and doing what they're normally doing. But you have to see what the instance of infection is in the community first.
Yeah. Wow. So every piece is complicated.
Yes.
Literally every piece is complicated. There's no perfect solution. There's no perfect anything. And you're doing the best you can to solve complications. Jill?
What about if a person is too sick to even mobilize to get to a testing site?
So if you're too sick to get to a testing site, you better have already called your personal physician. If your personal physician who knows you believes that you're too sick to care for yourself at home, by all means call 911. We will take you to the hospital or find an effective means of getting you to the hospital. Someone called and left me, this is an important message for the community. Somebody yesterday left me a voicemail, 2 voicemail messages, that their loved one was having difficulty breathing. I want to be very clear with the community. My voicemail, my email, is available to anybody to ask questions. And I've gotten, I hope, back to 100% of the people that have asked questions thus far. That being said, I can't check it real time. So if you have questions about someone sick at home, your first call should be to your personal physician. I do not want to see voicemails coming in my email box about someone having difficulty breathing again. If you are having difficulty breathing, please call 911. Call your personal physician first. If you cannot reach them first, call 911. Nobody should be at home, challenged to breathe, waiting for me to call them back. Is that fair?
Oh, way more.
Quite. A little different vein, what messages or requests would you ask town residents to make to our state and federal representatives and other officials if there were to be a united message?
There have been a lot of calls that I've been on and that our local elected officials have been on that included our local delegation to the state as well as our federal delegation. Those calls have not been really productive, in my opinion, because it's not a legislative issue. It's not a money issue. Pretty crazy, right? This is a community that can pretty much support pretty much anything we need to do. We raised millions of dollars to fund PPE purchases. It's not a money issue. It's not a legislative issue. So it's really an executive, delivery of goods and services that are required, and the executive action just is not happening. Either they don't know how to do it or they don't want to do it, but it can be done. I'll give you a very good example. Personal protective equipment. There is a supply of personal protective equipment available, whether it's overseas and we're having trouble getting it through customs, we're working with someone who's helping us expedite through customs, or it's domestic, and it's going to the highest bidder. And what that does is, and be thankful that New Canaan's resourceful, we've been able to purchase at pretty high prices equipment that our first responders and our hospitals need desperately. But it should not be happening. You should not have me from New Canaan, my counterparts in other towns in Connecticut, or the state, or other states calling the exact same limited supply, trying to acquire personal protective equipment, because all it does is drive the price up to the highest bidder. And that's very unfortunate. The only way this gets resolved is the federal government says, anybody that has any personal protective equipment that we need, we're taking free. We're not going to pay you anything for it. It'll stop the black market in 2 seconds. They should take it all and then distribute it. It would stop me from competing with someone from North Carolina to buy the exact same 500,000 N95 masks right now.
Yeah.
And we're just not doing that. And that's a failure to act. It's a failure to understand what the role is in government. So I'm very thankful that we've got great support in town, and we are incredibly resourceful, and we're productive. We're delivering things to our hospitals and our towns right now as we speak. But it shouldn't come to that.
Yeah.
It never should have been in that position. So the question was about our legislative bodies. They are, they care, and I appreciate their caring, and they're willing to support us, anything that we can do. Unfortunately, they can't support us. They can't get a message back. And that's also another important message also on politics. There's no place for it in any of this. So it's not a secret. I didn't vote for our president, but I support our president because we had no choice but to support our president. I didn't necessarily vote for all of our congressmen, but I support them. We have to work together to find the best means possible. And playing games, trying to have a power struggle with somebody that holds the keys to our future is kind of foolish in my mind. So, and I think they all get it. I think they now get it. They got to put their swords down, stop talking about elections and politics. This is not a Democrat or Republican issue. This is purely a healthcare crisis. It's becoming a financial problem, but that's not going to solve it. It's purely a healthcare crisis right now, and we need support in building out our supply of product and also our hospital beds, and that's what we need.
Okay, Mike, that bell that tolls in the distance that some of you might hear. Yeah, Jill, I'll try one more.
I just want to say, no, there's so many more questions,
Yeah.
and so I apologize to everyone who sent questions in, that if you feel that they weren't asked or addressed, but we'll do our best.
What's the best way to get to those? Tell me the best way to get to those questions.
Well, I'll try and compile them. We'll have the staff compile them, and we'll see if we can knock them out, put up an FAQ or something like that, maybe on our website, I don't know, or on the town website. Something like that. Maybe we can consolidate
these. Is there
these.
any benefit to us trying this again at some point before next Sunday?
We're in business all the time for the common good. So why don't you and we can talk during the week to see if we might reboot. Certainly Sunday mornings with Mike is a good thing. So I'll see you next Sunday. And so we'll be back to questions. And in the interim, perhaps we will figure out how to get the news out that we can do this again.
Stay healthy.
Yeah, I do want to end with where I ended last week and the week before, which is to say to you, to convey to you the gratitude of the community for you and for the work you do. I want to convey that gratitude to your wife. My sister called me up and she said, when you talk to Mike, you make sure you thank his wife. And so my sister says thank you to your wife and your household.
Your sister doesn't really sound like that, does she?
Yeah, my sister is awesome. She really did call me up yesterday to tell me to thank you. I'm not making that up. The other thing is Kevin Moynihan, our first selectman, and Janet, the director of Health and Human Services.
We have an amazing team.
Unbelievable people doing unbelievable things. These are people who are stepping up to the crisis and getting the job done. I know that you get 200 responses to, it is 7 o'clock, this is Mike Handler with the 7 o'clock call. The fact that you get 200 responses and you're actually thinking that you're going to be able to respond, to me, means you're crazy. Because you have many things to do. I don't know how you can do that. And not every one of those responses is cheery-faced, but I want you to know that we have extraordinary gratitude to all of you for stepping up in a crisis, doing the right thing, and doing the battle and fighting your way forward. So on behalf of the common good, thank you.
And I will share that with my wife and the team.
Yeah. Okay, peace be with you.
And you.
Peace be with you. Thanks, everybody. See you next Sunday and maybe sooner.